A good afternoon to you all here. My name is Ina Jurga. I'm from WASH United, and I'm the International Coordinator for Menstrual Hygiene Day. And on behalf of the organizers, I warmly welcome you to the session, Menstrual Health and Hygiene Movement, Together for a Period-Friendly World. The organizers are UNICEF, WaterAid, the Sanitation and Hygiene Fund, AfriPads, Agence Française de Développement, and WASH United. And I welcome you again all here and also to those joining online. I really remember for the World Water Week back in 2010, there was one speaker in one session who talked about menstrual health and hygiene management in India. And I think this was the first time someone talked about the issue. And people in the room were a bit irritated what to make of it. And so I'm really happy to be with you today in a room full with people really interested to talk periods. So yeah, thank you for being here in this session. So a decade ago, menstrual health and hygiene has been really neglected and sidelined. And luckily, things are changing now. And that is really important because menstrual health and hygiene is not a nice-to-have issue. It's not the cherry on the cake. It is fundamental, especially for those quarter of the world's population who are menstruating every month and to fulfill their full potential. It is critical for girls' education. It's important for women and girls' health, well-being, and economic empowerment. And if women and girls are not held back because of their period, not only they, but also their families, communities, and societies they live in will benefit. And just to share with you a powerful quote from the World Bank, who said, menstrual health and hygiene is fundamental to build the human capital of nations. So menstrual health and hygiene has really moved, started with issue 10 years ago around girls in schools. And for those of you who joined this morning's sessions by the GMP, who shared data, you really can see the progress the issue has been making in that field. And it's so critical and tremendously helpful to have this data, thanks to the JMP team and UNICEF and WHO, because it really creates the necessary awareness on the issue for funding, political advocacy, and programming. And since then, we've seen the issue of menstrual health and hygiene really move beyond girls in schools. We talk about period-friendly workplaces. We talk about menstrual health and hygiene in humanitarian settings, and we also start to establish linkages to climate change. So really broadening it out significantly. Like 10 years ago, as I'm the international coordinator for menstrual health and hygiene, we really established Menstrual Hygiene Day back then as a collaborative campaign to accelerate awareness and action on MHH. And the progress that we see through the MH Day results over the last 10 years really shows how we all together have made the progress. So I want to show you some of the impact data from the last 10 years, including for this year, which you probably haven't seen yet. So back in 2014, we started with 155 partner organizations, and now we're more than 1,100. Media coverage. We counted 89 media articles on MH Day globally, 89, and we were really excited and proud. And this year alone, there were like more than 23,000, which is amazing. And the total campaign reach started with 22 million in 2014. And this year, it's close to 1 billion people that were reached with positive taboo-breaking messages. And this is really thanks to everyone joining the voices. So a big clap to you all. So yes, amazing progress. And we believe a period-friendly world is possible. And making menstrual health and hygiene a reality is not rocket science. We know what's needed. It's education, menstrual education for all. It's period-friendly wash infrastructure, access to safe menstrual products, health services, and for us, above all, no more stigma and taboos in the society. And yes, there's progress, but we really have to do more. And therefore, in this session, What we'll do is we will look back in the first part, and then in the second part, we will look forward. In the part 1, you will hear from 3 amazing presenters on progress in menstrual health and hygiene across different geographies, as well as in humanitarian settings. And in part 2, we have a fantastic panel who will look at what's needed in the future to create this period-friendly world that we're dreaming of. In between, there is question and answers, so I hope you're also actively listening. And my wish for these sessions today is that you're equally excited about the progress that you'll hear from. You'll understand some challenges and gaps that still needs to be tackled, and leave the room with the motivation and commitment to really together push MHH forward to create this period-friendly world. So, without further ado, I start into part 1, looking back. And we have this really nice tables. So I want you to take 2 minutes of the time to speak to your neighbors, introduce each other, and to discuss in which 2 areas of menstrual health and hygiene have you seen the most progress. And areas, we talk here about the kind of the technical areas, and it could also be policy, finance, or others. So I'm not talking about geographical areas. So yeah, I give you 2 minutes to share among each other where you've seen the progress. And for those of you who join online, just type it in the chat box, and my colleague Sarah was there. She will see what you have typed. Thank you. No, it's very quick, but give you 30 more seconds. All right. So I hope you had some interesting discussion, and you, of course, can continue after the session. I wanted to do this also so that you connect and learn from each other. So just to see a quick raise of hands, who shared that there is progress in education, like menstrual education. Do you see progress in menstrual education within period-friendly wash facilities? Yeah, I hear, yeah. Silent, quite, yeah. Around breaking the stigma and taboos. Okay, a few more hands. And access to products. Yeah, most of the hands. So yeah, still huge gaps, but we discussed this a lot. Okay, without further ado, I want to move into the part one where we hear from 3 presenters. And we start with hearing about progress in sub-Saharan Africa, and from Ghana, from Eru Babena Yanji Akufur, who is the country director from WaterAid. I'll introduce her in a second. Then we have a feature on progress in East Asia and the Pacific from Chelsea Huggett from WaterAid Australia, and progress in humanitarian settings. So without further ado, I invite Eru Babena to come to the stage and share with us your insights from sub-Saharan Africa.
Hello. Thank you so much. My name is Irabna Nyanyi Akofo. I'm with WaterAid Ghana, and I'm really excited to be here this afternoon, morning, wherever you are joining us from. So today I'll be sharing with you some of the statistics around MHH in sub-Saharan Africa. And just like any other place in the world, the same way in sub-Saharan Africa, we believe that access to improved menstrual hygiene and health is a critical part of gender equality, dignity, and then also improved women health outcomes. And for millions of girls and young women and women like me, having access to proper menstrual hygiene and health means that being able to go to school, being able to have a dignified life, and also just being able to fully participate in communal activities. So my hope is that in my slides, I'm going to share with you the statistics in Africa, sub-Saharan Africa specifically, and I also share with you 2 case studies from West Africa, and then some of the learnings that are presenting opportunities in terms of how we move forward to 2030. So we have made significant progress. There have been so many things that we have done in the last decade, which has really helped us to come this far. But then we also recognize that we still do have challenges. So approximately 65% of girls and women in SSA do not have access to affordable hygiene products. And only 12% of schools actually provide these products either for free or for purchase. In terms of knowledge, half of young girls in Africa receive formal education on menstrual hygiene, meaning that half are not receiving anything. And this means that they may be misinformed, they may be misinterpretation around what to do, or even feel ashamed around what to do during their first menstruation. And only 30% of schools are also providing education in menstrual hygiene in schools. The common symptoms when it comes to menstruation, or the common challenges that people experience, is still cramps and period pains. And most people are not seeing the doctor or a health professional for help when they experience the pain or any discomfort at all. And yes, today we have up to 20% of young girls who are missing school because of their menstrual cycle, or 19% of women like me who are missing going to work because of their menstrual cycle. When it comes to policy, West and Central Africa countries mostly have our ministries that are leading on menstrual hygiene education. And we have many policies and plans that do mention menstrual hygiene and health in them, but progress among these indicators vary across the different countries in this region. What has been the barriers that we have identified over this last decade? So one is the lack of funding and policies and coordination. We are working in silos, and sometimes even as much as that we talk about coordination, we are still working in silos and we are still competing, which means that we are not using resources as efficiently as we could. We are also still struggling with poor facilities in schools, poor facilities in healthcare facilities, poor facilities in public settings, which makes it difficult for women and girls to even change during their menstrual cycle. And then also, we have lack of data, especially at the country level. We are not collecting routine data that can inform learning and adaptation to make decisions on time. And then, yes, taboos continue to restrict us in making sure that we are having effective conversation, addressing issues around adaptation of proper products and solutions. So this is a case study on a project called Hair Wash, which was implemented in Burkina Faso, Liberia, and Sierra Leone. And this was looking at integrating sexual reproductive health rights in government programs, particularly at the local government level. And some of the successes that we saw is over the project period, we saw municipal assemblies or local government authorities increasing their budget for MHH at 0% at baseline to 2.11%. And this is not a small milestone because it means hundreds of thousands or millions of local currency now being invested just in menstrual hygiene, which didn't used to be the case. And then we also saw 93% of national government and civil society stakeholders increasing their knowledge and awareness about the subject. Then, most importantly, 83% of women and girls reported using acceptable menstrual hygiene products as compared to 55% at baseline. Now, another spotlight on Ghana. This is a project that is called SHARE. It is being led by Right to Play with partners including Fairway, FHI 360, and WaterAid. And this is also looking at integration of sexual reproductive health rights in Ghana health services and programming. And some of the progress that we have seen in this project in the last 2 years, we have seen an increase in the production of reusable pads and distribution of these among schools in the targeted areas. We have also seen collaboration to establish hubs for menstrual hygiene, reusable pads across the districts that we are working, about 84 districts that we are working in. Health professionals and caregivers being trained on how to provide MHH information to their clients when they come to the facility or during their community health outreach programs. We have also increased awareness among population on the issue. We have also seen chiefs, queen mothers in the local areas that we are working in instituting bylaws when it comes to MHH. And then also working with the Ministry of Education as well as Ghana Health Service and CBOs in the area to advocate for the removal of local taxes from menstrual hygiene products. So, what are some of the lessons that present opportunities for us as we move forward to 2030? There is certainly the case to increase investment, to make sure that we are collecting data, particularly at the country level, timely data for timely decision-making and for learning and adaptation. Also developing cross-sectorial partnerships, tracking policy progress, and continue the promotion of the menstrual health education, and also driving public demand for improved menstrual health policies, and creating a strong voice for collective action at the country level. Thank you.
Thank you, Eva Barbena. I love that you narrowed it down, and also what you made really a strong point about dignity and integrating it into other sectors. Yes, here we are on a WASH conference, but establishing linkages to sexual reproductive health and rights, to the education sector, are so critical to move to scale and forward. So as a next presenter, hold your questions, we'll have a Q&A afterwards, is Chelsea Huggett, and she's the head of strategy at WaterAid, and really specialized in gender equality, social inclusion, and menstrual health. And here is your clicker. You're going to present on an interesting review from the region. Over to you.
Thank you so much, Ina. I'll just make sure this is close. I'm much shorter than others. So it's really interesting to hear what Yorubina's presented from the African region, and we can contrast and look across other parts of the globe towards East Asia and the Pacific region. Just to say, this is a collaboration with UNICEF. Brooke Yamakoshi in the back there really spearheaded this and drove the support within UNICEF to make this happen. And Dr. Julie Hennigan was really behind the methodology together with Brooke and I. So we did this in 2022 and we published the findings last year. And we had two objectives. So we looked at 18 countries across East Asia and the Pacific region. And we wanted to understand what progress had been made in policy and programming and what were the barriers and enablers to that progress. And secondly, what evidence was there for that change and that policy and programming, and to understand the enablers, barriers, and next steps. I think the methodology of this review is perhaps what would be of interest to this group. We developed a methodology which applied the global definition of menstrual health that was developed in 2021 by some people who are in this room, and the 5 dimensions that I'm sure many of you know really well. The first one around access to services, the first one, access to education, access to services, access to care for disorders and discomforts, access to social supports, and then non-discrimination and participation. The 5 domains of what good menstrual health is provided us with the what did we look at? To then understand the how had progress been made, we applied the sanitation water building blocks, 5 building blocks. So we looked at policies and strategies, institutional arrangements, and that included the intergovernmental coordination mechanisms, funding and financing, capacity, and monitoring, evaluation, and review. The slide gives you an overview of the report and how we've framed the findings. So what I'll share with you is just a bit of an overview for you to go and look at the information. For 14 of the countries, we did a deeper dive, and we've published case studies on those, which have lots of information in them as well. So to share with you some findings around the first objective of policy and programming progress. We basically tracked progress in policy applying the 5 domains. So we looked at policies from health, sexual reproductive health and rights, adolescent health. We looked at humanitarian, WASH, gender, disability, and there's one more. There were 8 types of policies that we looked at. And we looked at government, national strategies, action plans, and policies. And we tracked them according to the domains of menstrual health. And really what we found across both the Pacific and East Asia is that the first 2 domains of menstrual health are what's being addressed in policy, but those remaining 3 domains are not being addressed or have very limited progress. Indonesia was the only country we found that had some kind of policy strategy that addressed all 5 domains. So in the report, Table 10 provides a really great snapshot across the Pacific, and Table 5 provides a snapshot across East Asia. We only found one country in the review that had a disability inclusion focus in their menstrual health work, and that was Vanuatu in the Pacific. So turning to institutional arrangements, what we found is that the greatest progress had been made in countries where there was clear ministerial leadership, where there was assigned roles and responsibilities, and there was existing coordination mechanisms in place. In East Asia, most of the progress or the policy ownership was with the education and health ministries, and in the Pacific, it was mostly led by departments responsible for WASH and health, which often did cut across health and education ministries as well. What we found, and similar to the findings from the African region, is that coordination across ministries was really lacking. So when we talked to stakeholders about this, many felt that while they knew that a holistic approach to menstrual health was needed, they were focusing on specific sectoral approaches. So as the quote says, we're talking about education, but then if we don't have the infrastructure in place, it doesn't complement each other and people can't improve their menstrual health outcomes. Looking at financing, this was one of the critical gaps right across the region, and I'm sure this is the same in many of the countries where you work. There was really limited documentation about what financing was needed to actually meet the essential services for the whole population. The Solomon Islands, Indonesia, and Timor-Leste had examples of menstrual health costings for school wash infrastructure, but they were some of the only examples that we could find. The government of Fiji had a really interesting initiative to invest in menstrual health products for girls in school, but we couldn't find any examples where there had been really adequate costing analysis done for what menstrual health services were needed in a country. And if you look at the policy focus, what we found is it was mostly reaching school-aged people, so you have whole parts of the population who are missing essential services. So really, I guess there's practical steps that are needed, and this comes out in the recommendations around needing to really cost out those menstrual health targets, allocate funding, support for that budget execution, and then the tracking of targets. Stakeholders talked a lot about the lack of funding when we spoke to them. So inadequate dedicated budgets or limited allocation for menstrual health was seen as a real constraint. So in Timor-Leste, the example was given that even though there is some funding and budget for activities, it's not reached universally across all schools. So shifting now to the progress and programming, and what I didn't say before is we did quite an extensive literature review to understand what was happening in the region, and we did over 50 interviews. So we did talk to a lot of people and read a lot and learn a lot about what was happening. When it comes to programming, it's mostly small-scale individual projects, and we found it really difficult to assess the quality of that work, which was something we'd hoped we could do, but was a limitation of the methodology. It's delivered by a range of actors. We saw lots of non-government actors as well as government actors and the private sector working in menstrual health. Primarily, menstrual health was a mainstreaming approach across WASH, health, or sexual reproductive health and rights, and as I said, predominantly in schools. So Table 7 and Table 10 give a really quite detailed analysis of the programming progress that's made in the region, or both regions. There we go. So moving on then to Objective 2, which was around the monitoring, evaluation, evidence. This was a really significant gap across both regions. So at the national level, we found that there was really very little monitoring of menstrual health because there was a lack of policies, so therefore, of course, there's going to be a lack of national monitoring. One of the recommendations that we make is to apply the short list of indicators to help standardise and improve monitoring across the region. Stakeholder insights around why there was limited program monitoring. A lot of people talked about how menstrual health falls through the gaps. So they might be working on WASH, health, SRHR, and not really thinking holistically around menstrual health. And people really felt there was a lack of tools, which was quite interesting given how much work has gone into monitoring and improving menstrual health, and just shows that having platforms to collaborate and share learning is really important. Some of the enablers that we learnt about was the collaboration between researchers and programmers and leveraging what tools already existed. Just to flag, there's also a systematic review that Dr. Julie Hennigan led as part of this, which I can share the link to at the end, which really found that there's urgent evidence needed to help guide the selection of policy initiatives. So while I think this review gives a really fantastic overview of the progress in programs and programs and policy, we don't really know the quality and the impact that that progress is having. And so just to end on our call to action, these are 4 key areas that UNICEF, Burnett and WaterAid are really committed to driving in the East Asia and Pacific region. We really want to see an acceleration of sustainable support to strengthen the systems that underpin the unmet need for menstrual health. We want to address the neglected requirements for menstrual health, and for that we need a greater evidence base around diagnosis, treatment and care for menstrual disorders, and really tackling the social stigma and dismantling that. The third area is to really strengthen the monitoring, evaluation and evidence base, and we need the research programmatic partnerships to make that happen. And then finally, the 4th piece is around sharing learning and really building those collaborative networks and spaces to provide technical support and learning. That's an overview of East Asia and the Pacific, and yeah, really looking forward to the rest of the session. Here's the links to get the report.
Chelsea, it's hard to condense this really extensive, structured piece of work that you conducted into 10 minutes. So this was a teaser. So if you want to read, we'll also share all the resources mentioned today with you afterwards for those joining today and online. Also, Chelsea, you mentioned MHH for vulnerable people, like people with disabilities. And that's why it's a great link to the next speaker, which is Michelle Cheng Willing, who talk about how important it is to also address menstrual health and hygiene for in humanitarian settings, because we'll see more disaster. We know that the number of people who are refugees and internally displaced are increasing on annual basis. So periods don't stop in emergencies. So over to you to share your experience.
Thank you. And then, yes, okay. Thank you very much, Ina. My name is Michelle Chinkwilink, and I work for AfriPads. So I'm coming to you from a little bit of a different angle, as we're a social enterprise manufacturing reusable sanitary pads in Uganda since 2010. So almost 15 years since AfriPads began. And I will focus again, bring us back to the African continent mostly, and a little bit of the Middle East. But just in case you don't know us, we're based in Uganda and manufacturing the reusable pads also in Uganda. And I wanted to also say a thank you as a way to kick this off to organizations like WASH United, the Global Menstrual Health Collective, Reproductive Health Supplies Coalition, who are not afraid to work with private sector, because we are a social enterprise, but we're also a private company. And it's great to see these organizations who can do on a global scale this kind of awareness, prioritization, advocacy that we, a small social enterprise in Uganda, can't do. We've been involved in, I think, 12 pilot studies over the last few years, and many of them are in the humanitarian setting, so refugee settlements mainly. And as you can imagine, then that's with UNHCR, IOM, and across the African continent. But as we are based in Uganda and working a lot in Uganda and Kenya, I think we can speak quite well to the situation in this humanitarian sector. So if we look back, since 2014, the number of refugees in Uganda has quadrupled. It's now, if you include also the internally displaced people, it's around 1.7 million. So that has gone up steadily, and as Ina said, it's likely not decreasing anytime soon, unfortunately. Kenya, 770,000 or so, and it's predicted in DRC, in the Congo, that there's around 6 million IDPs. So we are in a region with a lot of humanitarian need. And just to give it some context, we as AfriPads supply between 600,000 and 800,000 girls and women per year with the reusable pads. So while we're not the only player on the continent or actor who can provide menstrual products, that's still, as you can guess, it's not enough. To provide this dignity and critical menstrual product for the number of IDPs and refugees in the region. I was asked to look back and consider what has changed and what was the situation before, and what do we see now that has improved or potentially become more complicated. As all the other speakers have already said, menstrual health and hygiene, either prioritizing it or not, has quite a great impact on these other sectors. So WASH, sexual reproductive health, education, gender, protection, all the main lists that everyone has already been talking about. And what we saw before is it was quite overlooked in emergency settings, but that has changed quite a lot. Where it is no longer, where it is made more of an explicit priority So we have seen a change there, but it still can fall through the cracks, as Chelsea was saying. It somehow never quite fits exactly into one of the other categories or can be easily forgotten. And we get it. In an emergency, often your first thoughts are on clean water and food or nutrition. So, of course, it's understandable. But given the major impact, especially for women and gender equality, on not having a dignified solution for their period, for menstruation, we would say is also very critical and should not be deprioritized. Or, as she said, it doesn't pause. Periods don't pause for emergencies. There's also the unique challenges in a refugee settlement. So perhaps some of you work in this space, and it's not just so it's a low resource environment. So of course there's always the issues around water, but it's also having to do with often quite a wide range of cultures coming together. So there's no perfect solution for menstrual products in that case, where it's culturally accepted in one to have an insertable menstrual product. In another, you may not be able to dispose of a product with blood on it. You might need to bury it. In another, you can wash it. In another, you can't wash it. So it's quite the cultures that come together, and it's transient by nature. So this provides challenges in the supply of menstrual products, as well as in the education and training around hygiene and the proper use. How can you manage your period on the go in a hygienic way? So these are quite the unique challenges of the settlements. Fun. So like I said, we as AfriPads, we've participated in several pilot studies. The most in-depth was done in Uganda in the Chayaka settlement region. Unfortunately, it was 2018. Hopefully, I'm still allowed to use it. And we will have a new one to present on by next year from South Sudan that we're doing with IOM. But regardless, maybe it's perfect because it's about halfway looking back in the decade. But the main things that came out of this pilot study, and I wanted to point them out that relate to how things have changed, is we have seen a greater focus from the humanitarian organizations on listening to women's needs, listening to the cultural needs, providing products that are sustainable, that don't bring about more challenges such as waste disposal. So, not just because we're AfriPads, but we saw there has been a major uptake in reusable menstrual products, which has, yes, again, there's not one perfect solution, but this has been a way to limit other challenges with menstrual health in emergencies. So a big uptake on reusable pads, and that's also more budget friendly. If you're coming from the donor side, more budget friendly distribution. So if distribution was a challenge, now you're looking at once in every 2 years for a single individual woman, because most reusable products last 2 years, or in other cases up to 5. So that is far less challenging than a monthly distribution of single-use products. So that's been a big uptake and quite a big change. We've also been happy to see that. A while back you had IRC and Columbia University who put out their MHM and emergencies toolkit, and we also see the effects of that is used in budget donor decisions on prioritizing menstrual health in the refugee settlements and considering those critical business elements of it: distribution, product life cycle, the supply chain, the budget. Yeah. Oops, sorry. While we've seen quite a lot of the positive shifts and more organizations explicitly prioritizing menstrual health and menstrual products, everyone's talking about it this whole week and this whole past year, but if budgets downsize, then menstrual health is often one of the first to go, and that has stayed the same also for the refugee settlements. So we've seen it get cut from budgets, unfortunately. We also have a challenge, or a continued challenge, I would say, in the scaling of the training and education aspect, with a lot of turnover also in those working in the settlements themselves from the various organizations and the different languages present of those passing through. That's also continued to be a challenge, and that we haven't seen a great. We haven't cracked the code, so happy for any collaborations or suggestions there. And lastly, what I wanted to point out before my time is up is that where we see it shifting, so where we think it can go, is we would like to see more funding for market-based approaches. And yes, I also believe this can work in the refugee settlements. A small company like ours, behavior change campaigns, marketing and advertising is very expensive. So instead of putting your budget behind donating for free, although yes, in humanitarian setting that still could be extremely useful, we would like to see it with a market-based solution so that we can provide product choice, affordability, accessibility. Thank you.
Thank you, Michelle. You can stay because we have, and I would like to ask Chelsea and Erubabina to come on stage too, because we have some 10 minutes for question answers from the floor as well online. So don't be a stranger. Start in the room with, if you have a question, just please stand up. There's a mic. Yeah, in the front. There's a mic coming.
Thank you so much for great presentation by all of you. So this is Raju Tirua from Nepal, and I have a couple of questions to know about this menstrual health and hygiene management practices in Africa, in Ghana, East Asia and Pacific. So in this regard, we are also working for this menstrual health and hygiene management. So in Nepal, especially in the western part of Nepal, there are many kinds of social taboos and harmful practices of even menstrual hygiene management. So I want to know that what kind of social norms, social taboos, discriminative norms are practiced in Ghana and other areas as well. You have also mentioned social taboos. I want to know about this. And another is that actually most of the women and girls are using sanitary pads which are not disposable. So what are the disposal options now? I think WHO has recommended not to burn it. So how can we dispose it? What are the technologies we have been adopting? And the third one is you also mentioned that I couldn't remember the name, the Ghana presentation, I would say. And yeah, and this is about the degradable pad. So what kind of degradable pad? How can it be promoted? And the next question is regarding this reusable pad. So did you go through the user satisfaction? In Nepal, this reusable sanitary pad are not easily accepted because these are bit quite maybe from the production to the use, and it should be washed very properly. This kind of some burden they feel themselves. So did you do that kind of user satisfaction? And also,
okay, free is a magic number. You got 4. I think last one short, please.
Okay. Last one is this. Do you also work about this menopause?
Okay.
Thank you so much for providing.
Actually,
time.
all good questions, I would say. Many, but please, over to you.
Okay, so the first question is on taboos and norms. Yeah, so in Ghana, mainly in the rural areas that we work in the north, there's a taboo to even talk about it, and particularly with the opposite sex. It is something that is just between you and your mom. But we are breaking those norms and saying that no. And then also, it is even a taboo for someone to see your pad. And so when we introduced the hygiene spaces in the toilet facilities, girls were not comfortable using the dustbins there because it's a taboo for someone to see it. The belief that someone could take it and do juju, or cast some spells on you. But we are letting them know that no, that is not the case. It can be burnt. It can be, added to the dustbin for the rubbish collector to take it away. So that is what we've been trying to overcome. And then also creating the spaces for young girls and boys at school to talk about it. No need to laugh at the girl when you see that this is happening. It's normal. And so, especially on MHH days, we have both the young boys and the girls coming together even to create drama for the community to let them know, no, it's normal. My sister, my mother, my cousin, and I have to respect it as part of life. And I think those are some of the norms we are breaking.
Mm-hmm. Michelle, you want to say something about the user satisfaction?
Sure.
Yeah.
I'm biased. No, so product preference is probably our most important KPI, or the product uptake. So, and we are also will be the first ones to be honest when a study came out that due to some kind of norm or practice that if the reusable pad was not preferred, that is the outcome. And like I said, there's not a perfect product. So product choice for us is one of the most important elements, because that is the core, maybe even of dignity, that you can choose for yourself what product works best for you. But yeah, I can't speak to Asia, but we can speak to the African continent, that almost everywhere we have worked, that it is usually 95% or higher of the product uptake that they liked it, used it, would use it again, would recommend it to others. And I think, at least in the context where we're working, that's also because it's extremely recognizable of a product, a washable pad. It is an improvised and higher quality version of a cloth that you would have used, or that people were using in many cases anyway. And this time it doesn't leak, it doesn't stain, and it lasts quite long. So the issue of actually washing it yourself in most places has not been an issue, but we do see it in a few. There are definitely a few countries where it is not accepted.
Anything you want to add, Chelsea?
Yeah, great range of questions. Is that one on?
Mm-hmm.
Oh, yeah, I think your question about stigma and taboo, I think, is interesting, in that a lot of the stakeholders that we spoke to, who were national government representatives, experienced stigma and taboo within, providing government services. So when a lot of people talked about it, it wasn't just among community members, it was actually among people working in ministries of health, ministries of education, or teachers and schools. So I think the stigma and taboo issues are actually at the systemic level, not just community level, which we often don't focus on.
Yeah. And just to say that, I think the stigma around menopause, perimenopause is also slowly breaking, and you'll probably hear about this more in a few years. Is there one final question here that you... Yes, in the back. Mm-hmm. We have 1 more minute or 2 more minutes.
I just wanted to know any thoughts on dropout girls, because most girls also don't go to school. So any work which has been done for us to learn from.
So out of school girls, how to reach
school girls in communities, because we are all talking of school girls all the time, but there are many who don't go to school.
Mm-hmm. Yeah, I think I can. Yeah, that is very true. And so with the SHARE project, they saw this as a gap, and so part of the training also targeted out-of-school girls, and did not just focus on in-school girls.
And you can read up some of the recommendations in our report.
Yes.
So we're going to share that report if you want to learn more about it. So give a good clap to the experienced experts here. we're moving forward into part two of the session. It's looking forward. And again, I want to have a bit of energy in the room. I know it's getting late, and you've been at the conference since maybe Sunday, since this morning, so I give you a little bit of energy related to the rocket there. So please stand up. And we're doing a rocket launch for MHH in the future. So maybe some of you already know this. So it's like creating energy. And we do a countdown. 10, 9, 8, 7, 6. Louder. 5, 4, 3, faster. 2, 1. Woo! Okay. And with that energy, again, meet in your table and discuss for 1 or 2 minutes in which 2 areas of menstrual health and hygiene do you want to see more progress. We heard already a few gaps, we heard a few headlines, but please exchange in your group what you think where we want to see more progress. And then we move over to the panel.
Really interesting, yeah. Looking at reports that they've synthesized for Cambodia, Indonesia, looking at implementation in Ghana, and then the lady in pink, she's like the head of a company, a small company that creates menstrual products in Ghana. So talking about how they can increase their exposure and then what kind of products they offer, et cetera, et cetera. Stigmas. Yeah. In general, it's like any kind of policy in terms of you have a normative judgment that you want to see results based on some kind of scientific finding, and depending on whatever it can be. Like our goal in all of this is promoting human health. Why it's important to promote? No.
I think you also need to come to an end. I hope it was fruitful. I also like to hear from you after this session what you discuss and if you have several questions. But because of time, I'm moving forward into our panel. And we do it in a way that we start with 2 panelists and then followed by the next 3. So I would warmly welcome on stage Yogita Mumsen, who is the manager for the World Bank's Global Water Practice, where she manages and leads the Global Solution Unit and provides strategic direction in delivering cutting-edge technical solutions, advice and global knowledge into implementation, and supporting the operational teams. Welcome, Yogita. And the second panelist is Lionel Goujon. Goujon is correct. He joined the Alliance Française in 2009 as a task team leader in Paris. Then he moved to Morocco. Then he was also deputy director for operation support. And now, since 2022, he is the head of the water and sanitation unit. He worked in the field of artificial intelligence beforehand, really interesting. He also wrote an award-winning book. So yeah, welcome, Lionel. I start with you, Gita. So over the last few years, the World Bank has significantly stepped up the integration of menstrual health and hygiene into your programs. And for example, you also released an MHM resource package a few years back. And I mean, I'm personally glad that the World Bank supported Menstrual Hygiene Day, really from the highest leadership, and I shared this powerful quote earlier in the session. So can you say a few words about why the World Bank is prioritizing menstrual health and hygiene?
Sure. So first of all, is this working?
Yeah.
Okay, great. First of all, thank you so much for inviting the World Bank to this session. Very important session. So why? It's the right thing to do. Why is it the right thing to do? Because menstrual health and hygiene is about supporting women and girls, half the world's population. It's by supporting women and girls, dignity, health, and ensuring that they can go to school, and stay at work is important for the economy. It's we know that women, 50% of the workforce, potentially, will help an economy grow, leads to innovation. And girls in education, we know, turn into stronger mothers if they have that opportunity. So this is good for women and girls. It's good for society. It's good for the economy. It's a smart investment. So that's why we do it.
Very clear. Thank you, Gita. And next to you is Lionel, because also we invited you on stage because the Agence Française de Développement is really one of the few funders and who invest in MHH, and you also did it in a very structural way. So again, same question to you. Can you share why is the Agence investing in menstrual health and hygiene?
Yeah, thank you. Can you hear me? Yeah. Maybe I will not repeat the benefits, which all of you know, I guess, but maybe like as a testimony, explain how we went into MHH. Actually, it's been a progressive track for us, and you know, like, and we amongst the three pillars, it was not through awareness raising, it was not either through product hygiene product. Distribution, but rather the third pillar, infrastructure in water and sanitation, because this is what we usually do as a development bank. So we actually address the topic initially mostly through sanitation infrastructure in schools. This is how we got to face the thing. And I remember very well that 15 years ago, when you were speaking of sanitation in school, you could read already that lack of sanitation, proper sanitation, was a key reason for girls to leave school. But if you look in the literature at the time, look for periods, look for menstruation, you won't find it anywhere. So there was still a taboo, I think, even in the development world at the time. So this is how we started, and then we came to education awareness, and then to access of hygiene products. It became clear, of the benefits became clear. And I would say also that I'm sure, and I'm happy to say that WASH United helped us also to accelerate in that field, because we had known you for a while, and we've seen your move towards MHH, and I think it's been inspirational for us also, and supporting you initially through the MH Day. Then we moved towards more financing in the sector, and so in the beginning it was like one element of a project, and I think the major evolution in the last 3-4 years was that it became a sector and a field of activity of financing in itself. Mm-hmm.
Especially under like a broader gender perspective of your work, correct?
Yeah, maybe one other two triggers were that in 2020, France decided to have a feminist diplomacy, and that translated into AFD activity becoming a feminist agency. So the gender issues took a wider part, and so that's helped us to also work more on the menstrual hygiene and health.
And moving clearly from WASH very, very broader. And I'll ask you a question in a second, but I want to turn to Yogita. How is the World Bank now integrating MHM, like on a practical level? And I'm really interested because you really closely work with governments in your funding. So maybe you can share how this process is working and how your approach is.
Yes, sure. Yes, we work with governments. We work through governments. The governments are our client, and they borrow or get grants from us, so it's all completely through the government. And so we started mainly by construction, working on the construction when we're doing water projects, sometimes projects in health and education, but mainly water projects, constructing toilets in the facilities, ensuring there's safe toilets, hand washing, soap, so the material aspects of it. But then very quickly recognize this is very much about behavior. And I have an interesting anecdote, speaking of government, and it's actually someone from the last panel mentioned this at the end, about the level of awareness and taboo. So one of my team members, super advocate of menstrual health and hygiene, male, he was very, very vocal and really advocating for the cause, and well respected in his country. And the minister, female, turned to him and said, "Should you be talking about this so much? I mean, you're a man. Should you be talking about this?" And that's how it started. But by 6 months later, 9 months later, he had her convinced, yes, she should be talking about it too. So I thought, even at the highest levels, this was the minister, was questioning, but with some effort, we got there. So behaviors and norms at all levels is really critical. So it's construction, but very much about behavior and norms as well. And also, it's not just working. There was a water minister, but in the end, when you're talking about schools, and I agree that it goes beyond schools, you want to provide these at health facilities and elsewhere, but in schools you would want to ensure that the schools have the capacity and the financing to upkeep. And so needing to work with the Ministry of Education to make sure that line item in the budget is there to make sure that you have sustainable facilities.
Yeah, thank you. I fully agree. It's a bit of a parallel that you shared, starting with WASH. And I mean, it's not a surprise. As we said, like the WASH sector was really spearheading the menstrual hygiene management back then. And now we've moved so much forward. So Lionel, also actually the same question. How do you invest now in menstrual health and hygiene? What are part of your portfolio?
So we still have financing which include a component for MHH, but the new thing since 2021 is that we do have MHH dedicated project financings. Actually, we've had 3 of them so far, and I would like to stress out that these projects have been a source of innovation within the French Development Agency, not only on MHH issue, but more globally, because the first one was actually a DIB, a Development Impact Bond. So I don't know if you're familiar with this tool, but it's a financing where there's a private investor, so a private bank, who is backing a sponsor of the project, which was an NGO in that case, and lending money and being repaid only depending on achieving results, and the repayment is done by IFD. So that's quite innovative, and so that was the first time we were doing that, and I think that's the only DIB in the sector so far. And it was in Ethiopia, and Ethiopia has been an important country for us for experimenting on that topic, because afterwards, and I think the innovation came also because we need to involve the private sector. If you want to work on the safe product availability pillar, you have to work with the private sector, which we are not that used to do. And so the second project was also in Ethiopia, and it was aimed at supporting private sector actors in developing the value chain for the project. And the third one, to conclude, maybe it's ongoing. It's about to start actually, And it was, we did a call for proposal for NGOs to implement a multi-country program. So the financing was awarded to a consortium of NGOs led particularly by Fos Feminista. And this project will be run in 9 countries. And it will be actually an intermediated fund, so where local NGOs and local social enterprises will be able to apply to this fund and be financed, and the whole management will be done by the NGO, international NGO consortium. And there will be also 2 countries like more advanced, which will be like doing peer sharing and showing their experience. There will be Ethiopia and Nepal as well, our Nepalese friends who are there will be supporting this project.
Yeah, I love it that you share that there can be innovation even within an innovative or topic. Really like it. And secondly, like this peer learning, I think that's why also we wanted to put different actors from different region here earlier in part 1, but also you both as actors here on the panel. Is there questions from the audience to Yogita and Lionel that you would like to ask?
It's late.
It's late? Yes, there's one question.
Give me a second.
Need to profit from them being here. Can you introduce your name and organization?
Yes. Hi, my name is Persis Ramirez. I work for Open Hydro, but I'm also attending the conference as a young advocate for water and climate action. And my question, so I know that the topic has not been sort of like discussed in depth, but any thoughts on period tax? Because somewhere down the line, menstrual hygiene management products are perceived as luxury items, and this is, it has a huge impact on affordability, accessibility, and I just wanted to know if there's any, discussions on this with governments or any agencies, on that regard. Thanks.
On taxation, is that correct? Did I understand correctly? Okay. You
go ahead.
Okay, sure. I think so far, we've progressed a lot in this area, but I think maybe one of the weaknesses of our action so far has been that the 3 project I mentioned represent 15 million euros. It's grant, and it's grant going through CSOs mostly. So from my view, one of the weaknesses so far is that we have not been able to involve enough governments. So the next step to us really, I believe, is going from non-repayable grants towards CSO to involving the governments themselves, and ideally, my hope, I won't say my dream, my hope, I think we will manage someday, would be to have a policy loan to a government to work on the MHH and specifically on the tax issue, which is a relevant one. So that's, we have to work on that, and I'm sure we can manage to have a policy loan on that in the coming years.
And if I might add, there's a website called periodtax.org where you find a bit more information, and you can also talk with Irubabina, who are just in the campaign in Ghana. So there's, but yeah, I heard you about working more with governments. So thank you so much for being here. And yeah, there's one more question. Okay, one quick question.
Thank you. So I'm Linga from Malawi, and it's more of a comment to Yogita. I do appreciate the comment that you're making around the bank supporting the water sector. You do that for the Lilongwe Water Board. I happen to be a director there. But on the part of menstrual hygiene management in terms of access to infrastructure, I know that the World Bank is doing a lot. Like in my country, they are supporting the education reform, and part of it is building infrastructure for primary and secondary schools. I think there's an opportunity there for the bank, USAID, they're doing the same in Malawi, the EU, to influence the sector by actually influencing the design of what we're delivering. Because you put up these beautiful structures, which we appreciate, but it's also very possible for you to be able to say, part of what we're going to deliver to support girls' education are these girl-friendly toilets so that they don't have to come as an add-on or a footnote. So I think it's you can demonstrate that model, which can actually, get our governments to really be thinking of just making it one of the minimum requirements when they are doing these designs for schools. Thank you.
Yes, excellent idea. Very, very true.
Thank you so much, and thank you for being here, and have a good rest of the day. And with that, I move to the next panel. It's like, it's like, and in the next panel, we turn to actors from the UN and civil society. We have Sue Coates. She's the Deputy Director of the Sanitation and Hygiene Fund and has multiple years of experience in sanitation in several sub-Saharan Asian countries. And now, as an executive director, she oversees the execution of the fund's technical priorities area, including sanitation economy and menstrual health and hygiene markets. Welcome, Sue. Then we have Torsten Kiefer, who is the founder and CEO of WASH United, my organization. And he has more than 20 years experiences in working on the human rights and WASH, and he's been working on menstrual health and hygiene as a male champion since more than 12 years. Welcome, Torsten. And then the last panelist is Maria Hüttels-Dorsten, and she works as a gender advisor with UNICEF, but she's also a really experienced menstrual health and hygiene worker, worked for several NGOs and also on SRHR, different NGOs, Care Norway, Womena, so in Uganda, for example. Yeah, thank you and welcome. Obviously, I have a bit of a different set of questions to you, and we also I really, with you, want to look at the future. Yeah. So, what is to come for menstrual health and hygiene? How do we really create this period-friendly world? And Torsten, I shared the data of menstrual hygiene before, but yes, we've seen it grow, but based on your experience, what insight do you have behind this data? So what's to come for MHM in the next 10 years, if you can look into the magic bowl.
Yeah, I think the MH data...
Can you speak close to the mic?
This one?
Yes.
Better?
Yeah.
So, it's a little bit, I'm a bit too tall for it. So the MHA data shows an enormous increase in conversations about the issue at societal level, driven by the media that take up the issue more, driven also by people standing up on social media for the issue, and increases in society level conversations. I think everybody hears me.
Yeah, okay.
Yeah. Society level conversations in the end also lead to more political relevance for the issue. And what we see is that in the countries that are most successful, we see collaboration, we see organizations working together, defining joint messaging, organizing on-site events, online campaigning, involving media, involving influencers, and then really kind of getting things out there. But what we also see, and so things are going well. We see the increases in awareness and relevance, but we also have to be careful. But what we also see the last couple of years is there is an increasing pushback. There is a huge anti-gender movement forming that is funded by right-wing sources in Europe, in the US, Russia, that is pushing back. That has troll factories in countries like Germany that will criticize political decision makers for being too woke and standing up for these issues. So, and these anti-gender movements are really, really well organized and they're well funded. The Center for Feminist Foreign Policy, friends of ours, they found that over the last 10 years, the anti-gender movement invested $700 million in tackling gender equality. So that brings me to the point that menstrual health and hygiene, unfortunately, is not as well funded yet. Last year, September, we launched a new website that is called the MHH Funding Tracker. Check it out. And there we collated together with a wide range of partners, including SHF, funding commitments of $1 million and above. We found 31. That's not much for an issue that concerns half of humanity. of these 31, 30 included access to products. 2/3 were exclusively access to products. And that also like mirrors experience that we heard from you, Rick, this morning from the JMP, that where 15 countries have access to products data, but only 2 have data on social supportive environments, the stigma, the norms that everybody talked about here on stage. So I think we need a lot more funding for menstrual health and hygiene, and we need to make sure that the funding gets a little bit more balanced across the different areas, that we don't forget anything, including especially tackling the underlying taboos and stigma.
Mm-hmm. Thank you, Torsten. What we don't need the glass bowl to foresee that climate change is on the rise, and that this also will impact menstrual health and hygiene. And UNICEF recently completed a technical review and contributed to an infographic by the Global Menstrual Collective that we'll share on the relationship between MHH and climate change. So Maria, can you briefly provide us with a short summary? What is the foreseen impact of climate change on MHH? Where's the relationship?
Yes. So as you said, UNICEF recently did a technical review compiling the evidence and linkages between climate change and MHH. There's a lot of existing research on the devastating impact of climate change on human health and well-being overall, but there is really a gap in terms of evidence on its impacts on women's health, but then also on menstrual health and hygiene. So we all know, though, that climate change is not gender neutral. Women really bear the brunt, and we have data on that. And overall, climate change is replicating the existing and exacerbating existing gender disparities and vulnerabilities. And that's then also even more so the case for the most vulnerable, as mentioned, with, for example, girls with disabilities and for marginalized groups. And that's also what we see in terms of menstrual health and hygiene. So we're already seeing kind of the impact of menstrual health and hygiene. So when it comes to climate-related extreme weather events, there's overall like 3 ways that climate change is impacting menstrual health and hygiene to highlight. Is first of all the access and use of menstrual products when supply chains are disrupted. There is also the access to essential facilities and services being hampered. And that's kind of, as we've said already, how that impacts personal hygiene, menstrual hygiene practices. It was mentioned by Michelle in terms of in humanitarian situations, how we are seeing that in terms of disposable of products and so on. And also less access to health services when they're most needed, information, social support, and so on. And then thirdly, there is the way that it's affecting in terms of safety, privacy for women and girls when being displaced, for example. And also how that is kind of the impact on menstrual health and hygiene is then creating even more stress, anxiety, and so on for girls related to menstruation, managing their menstruations. That it was said that periods don't stop when there is a crisis. And then moreover, just another point that we're seeing emerging from research is the kind of the troubling linkages between air pollution and disruption of the endocrine system that's causing hormonal imbalances. And even though there's a lot of gaps in terms of what those linkages are, seems to impact the women's health and menstrual health, and for example, in terms of potentially in terms of prevalence of menstrual disorders. But there's still a lot needed to understand this better. So just to conclude, so there's multiple ways that climate change is significantly impacting menstrual health and hygiene, but more evidence, data, as we see, as overall is needed. But there's potential long-term devastating impacts, as you've been said, in linking to women and girls in terms of education, economic advancement, and well-being, so that is kind of really, so potential wide-ranging impacts that are really kind of exacerbating the existing vulnerabilities that we're already seeing.
Thank you. I think everybody can really relate to that. I mean, we need more studies, but I think if everyone experienced bad weather crisis like floodings, droughts, or extreme weather, I think you can really imagine how difficult it will be then to manage menstruation. So I'm looking forward to this field of work continuing and hearing more about it in the future. Sue, so Torsten mentioned that the funding attention to MHH is really low, and we also heard about product access. So I have a statistic that still 630 million menstruators in low and middle income countries rely on non-purpose made materials, so they don't have access to quality products. I know that the Sanitation and Hygiene Fund is now want to structurally change the way people can access quality, affordable menstrual products, so to really close the gap. So can you share with us what your approach is and your new kind of thinking?
Yeah, by all means. So we're looking specifically at...
Can you also get closer?
Yeah,
yes.
I can. Can you hear me now?
Yes.
Okay, we're specifically looking at investment capability, because we know that there is a clear business case for investors coming into menstrual health and hygiene. So we're taking a market-based approach to complement what you've seen on stage. So we're filling a piece of the jigsaw. Just to add to those statistics, we know that by 2035, there'll be another 160 million new users, new people who need menstrual products. And as Ina said, they should not be people who are using non-purpose products. They should be using products of choice and affordability and of quality. And there's an annual revenue to be made in this market. And okay, you might be sitting thinking, well, I'm not sure about that. But there is a business case for over 28 billion annually within LMICs. So the private sector and the environment for the private sector, there's a real strong case for. So how are we doing this? Well, I like the rocket because we want to take a moonshot approach to actually look at structural change within this part of the sector, working in conjunction with the demand side and with all the other sides that you've been listening to. So we're looking at 6 barriers to market growth in LMICs. The first one is we've heard from AfriPads, and we know from the other companies that we've scoped and that we work with, is that there are there's not enough investment in business models. The route to market, a sustainable route to market to become commercially viable when you have a great idea and a great technology, a great product, is far out of reach. And companies are having to rely on grant. And that's not going to work the longer term. We also know that women-led businesses, there's huge scope for. And there's a huge amount of money out there that is gender-sensitive financing, gender-led business financing. We want to bridge those gaps. Can you believe that the air you breathe has a standard? The platform I'm standing on, the material will have a standard. There are no international standards for menstrual health products. And this is a critical market barrier. And so we're working on with ISO and actually with the International Standards Institute of Sweden to help change this situation. And that involves getting these standards into countries and getting that moving by 2027. I could talk all day on standards. Restrictive regulation, you've heard about it. Taxes, but also import duties, access to a different type of thinking when it comes to regulation so that we can get the power that we need to see in the hands of women. And that's working closely with governments. Only governments can make this happen. We also know that little is understood unless you work for a multinational company in this space about market maturity. How do you know what the potential is in your country if you're the government? And how do you know as an investor what your market potential is? So we're trying to look at the data to get that out and in the public domain. We need to crowd in financing, which we can talk more about. And actually, we need to work better and smarter as partners. Because every dollar counts here, as Thorsten has said, and we need to make sure that those dollars are working harder, because those dollars are getting harder to obtain.
Yeah, agree. And leads, you mentioned 2 points. One is long-term and one is also in a structural way. So Torsten, in your opinion, what could solve the funding challenges in a structural way?
I mean, one of the questions I typically get when I ask funders how much they invest in MHH, they tell me something like, well, we don't know exactly, but we do something in education and in health and WASH, and it feels like really a lot. And yeah, what exactly is it? Oh, we don't know, we don't track it, but I'm sure it's really a lot. I saw this project last week, and it was actually quite a lot. They don't track. And why don't they track? Because it's not part of the SDGs. There is no OECD DAC code. So it's kind of like a hobby topic that you do if some money is left. But yeah, if the budget gets tight, as they do nowadays, like in Germany, for instance, huge budget cuts, what is the first topic that falls off the boat? MHH. So we need MHH, we need to be elevated to an adult topic, not just to sit at the children's table where the kind of like the rest are eaten. We need it to get fully integrated into a post-SDG framework, whatever comes there. That I think is the long-term play. And
what can be done in a short? Any ideas?
I mean, I think like something every funder, any organization can do tomorrow is to start, define clear, measurable goals, track progress towards these goals and how much you invest in MHH and make that information publicly available, provide transparency, provide a basis for accountability. Basically just treat MHH as you would treat any other social development issue. That doesn't cost money, but it's just something that needs to be done. And when we talk with funders, I mean, Lionel was here, when you call AFD and ask them about what do they do on MHH, you get an answer tomorrow because they actually track. When you talk to the Gates Foundation, you get an answer tomorrow, but most others just have no idea because they don't do the homework. It's something we can do. Nobody needs more resources in doing that. It's just putting the work in and starting to track and define goals.
Mm-hmm. One quick question. I know we're running out of time. So Torsten talks about government and conventional funders, but who can be new funders, or we also heard about innovative funding models, but who can be new funders looking at menstrual markets?
Yeah, so if we're talking about investment capability, we have to talk to investors and we have to talk to impact investors and we have to bring them into this space and we have to fit them on the continuum, venture capitalists, private equity firms, angel investors, to get those markets really moving. So that's looking at the SME strand. But that's not it. We still need grant financing. Yeah, because grant financing de-risks investors coming into the space. This is critical, and this needs to be no longer ad hoc. It needs to talk to those structural needs and the structural changes. And we need money through grants to give governments TA, technical assistance, so that they can make the changes and they know which regulations to tackle. And then there are many small players, so we need crowdfunding platforms so that small monies can make more money and people can work together and collaborate. And then finally, we're talking to the development finance institutions. They're really keen on this, but they're way down the line. And we need to build in those other actors so that the long-term funding can come through the DFIs as it does for so many other sectors that we work in women's health.
And one quick question to Maria before we close. So we talk about finance now. We talk also about a new topic that needs adaptation and climate resilient MHH approaches. So do we need more funding? Do we need smarter funding? Is it additional one? Or is it maybe even an opportunity to invest even better from the get-go?
So I think in terms of what I highlighted in terms of climate change, that really kind of underscores the need for funding. I think because that will just even exaggerate the existing inequalities and vulnerabilities. And I think in line with what our approach from UNICEF on gender and adolescent girls, like mental health is one of the priority focus areas, in line with also focus on adolescent girls, and that we are kind of calling for really increased funding needs, because that is also a topic that gets kind of lost in the cracks and has a widespread impact, and same with menstrual health. So I think UNICEF is really advocating for really increased funding from all sectors on adolescent girls and on menstrual health in line with that. So I think there's a lot to do, but I think the kind of this, if we don't want to, we already see existing gaps, we don't want to risk kind of losing the progress we've already made. We need to really step up to really kind of integrate menstrual health and hygiene and gender and women's rights into, for example, climate change adaptation plans, strategies, and overall across the sector, as we've just discussed. So,
thank you so much. And with that, we're at the end of the session. I know we talked a lot about financing in the panel, and Torsten also made a suggestion about what can be done now without costs. And you know what doesn't cost any money? Talking about periods. Like, you can talk to your neighbors, to your colleagues at work, in your family, to your community, to your donors. That doesn't cost you any money. But just talking about it, and I hope that's what you take also from this session, that you're not shy to talk about the need for menstrual health and hygiene, because I emphasize it's not the cherry on top of the cake. It's essential that it is addressed for all women and girls. So I thank you very much to join this late session. I'll follow up with you with some of the resources. If you have further questions, feel free to contact me, and I'm happy to pass this on. And thank you so much, and have a good rest of the day.